People of Reddit, what is the worst thing a therapist, psychiatrist, or mental health professional has ever said to you? Do you have thoughts of unaliving yourself? Me, yes. Do you have a plan to unalive yourself? Me, yes. Do you feel you're a danger to yourself or will harm yourself before your next appointment? Me, yes. Great, I'll double your Prozac. See you next week. I was a nurse. I know if a patient says those sorts of things, it's an instant 24-hour keep in the hospital or admission for monitoring. And I wasn't joking, I meant it 100%. I never went back. Events happened that kept me from following through instantly with my plan, but I'll never forgive that bastard. I left the office thinking, welp, even a dude that's paid to care whether I live or die doesn't care. That seals the deal. That is not a great start to things for sure. Was it really a mental health professional that said that? That's insane. OP, I really hope that you're doing better now. Hey guys, we have a new channel where we go over very in-depth stories. Whether it's a Karen on the loose or a story about a mother's perspective on her husband throwing out their daughter's ashes. The link will be in the description. Make sure to subscribe to the new channel. Story 2. I was having panic attacks daily and the med he gave me made my anxiety worse. Turned out I was just having bad reactions to SSRIs, and that was all he kept trying like a moron. Anyway, I'm in his office, and he seems to be taking it personally that all the SSRIs he's put me on are giving me seriously bad side effects. Have you just given up then? The dude asks. Do you just want to be like this for the rest of your life? Obviously freaking not. That's why I'm in this office trying new medications. I was so angry and yet also having a panic attack at the same time. I ended up walking out and finding a new psychiatrist later. Story 3. I went to see a psychiatrist because I was having symptoms of PTSD after an abusive ex tried to unalive me when I left him. He then stalked me, forced his way into my apartment, and assaulted me. The psychiatrist, an older man, told me that I needed to work on my physical appearance and demeanor to be more feminine and demure, because quality men weren't attracted to women who looked and behaved like me. And if I ever try to get involved in another relationship without making myself more appealing to quality men first, I would end right back up in the same situation. If I'm understanding OP's post correctly, they weren't even asking about how to prevent it in the future or anything. This dude was just so out of line in two different ways. First of all, what an absolutely insane thing to say. Oh, dang, you got stalked, almost unalived, and then assaulted? That's crazy. Have you tried being better? Like, what? Because that's what it boils down to. It's just like, oh, you're not doing your woman job. I don't know. It's so stupid. Whatever. Moving on. Story 4. Not me, but my late father, and I am still pissed off. My brother, his only son, had a nervous breakdown after our mother died. He was good through and through. It was like losing two people at once. My father believed, sadly, that my brother would find his way home, but he never lived to see him again. We know he's alive out there. Now, I worked in a funeral home that assisted the coroner's office. If someone passes away, they can take fingerprints to identify them. Bottom line is there are many ways that they can identify a deceased person. My father was a trucker, blue-collar kind of guy. When he lost his leg, he lost his ability to work, and he hated it. I'm convinced he would have preferred to die in his truck, a provider, but he was a good father and loved his children. The therapist asked why he was depressed, and he said he misses his son. She said, "You know, there's a good chance he's been dead for a while, yet you've continued to live." He was quiet when we got into the car, and I knew something was wrong. Finally, he told me. I called the therapist and asked her where the hell she got off putting that idea in his head. The man had lost enough. He refused further counseling, and who could blame him? Story 5. When I was about 8 or 9 years old, I went to see a counselor who was supposed to help me deal with being repeatedly touched when I was younger. The jerk just kept asking me, "But didn't it feel good? It felt good, right? Just admit it felt good," etc. until I was a sobbing mess. When I told my mom, she refused to take me back, thankfully. Story 6. In high school, I was pretty difficult because of some real intense crap happening in my life. I wasn't on drugs or violent or flunking out. However, I had a super rough family home life as well as some assault stuff, and I withdrew because of it. My parents were very Sunday Christian, meaning while at church, they're the best Christians of all, but the teachings did not make it home. They still don't understand why only one of their 6 kids talk to them kind of thing. Anyway, they gave us no privacy ever. Always in our phones, our bags, our rooms, just in every aspect of our life if it offered them control. And I knew it would be no different when they found me a counselor and you know her. Guys, they sent me to therapy with the pastor's wife. It became super clear she was telling them things immediately, but I held out hope until I couldn't anymore. because I didn't have proof, really. I ended up telling her I got an offender bender, but there was no damage, so it was all good. Well, she told my parents right when I left, I guess, because when I showed up home, my dad demanded to see my bumpers. They won't admit what happened to this day, but they never made me go again, so there's that. Also, I guess this turned out mostly about my parents, but honestly, screw them and the counselor, too. I feel like the point of a counselor or therapist or anything is an objective view of things, right? The second you know them, doesn't that ruin the whole point? I guess some people just don't understand how it works. Although, according to what I'm hearing about OP's parents, they don't know how much works. Story 7. My family's counselor said, "That's called solitary confinement. I'm calling the police right now," when she discovered my elementary school was locking up myself and several other students in tiny closets every day. When I was younger, my sister and mom weren't getting along, and my mom decided we would see a family counselor. Most of my time with the counselor was easygoing, happy, and short, as I had nothing to do with my sister and mother arguing and screaming at each other all the time. That was until she asked me how school was going and started digging into what my daily life was like. In 5th-ish grade, I was caught trying to out one of my female teachers for verbally abusing students and cursing at us too. She used to get a rise out of berating one particularly sweet and timid girl in the class. Well, the teacher caught me recording her cursing and sent me to detention for the rest of the year. Detention equals 3 small rooms behind the principal's office, with room for just 1 student in each closet-sized cell. They would lock us in, and the only times we were allowed out was for lunch or to join other classes for wall sits in the middle of Arizona summers. We had to knock and ask to use the restroom, which was located in the principal's office area too, so no chance to see other students. Usually one of the small rooms, as we called them, was occupied by a mentally handicapped student who would scream and bang his head on the wall. Poor kid had no idea why they were locking him in a tiny room. Oh, and if any of us were really bad, they would turn the lights off on us until whoever was acting up would shut up. This usually made the screaming guy go berserk until he hyperventilated/passed out. Countless days spent plugging my ears and choking back tears. I eventually gouged out a small hole under the desk, which was permanently attached to the walls. I disassembled pens and would wrap a note around the ink cartridge, then pass the note and pen through the wall to whoever was on the other side. This lasted for a large part of that grade, but they eventually found the pen hole and punished all of us with more wall sits in the sun, while we watched everyone else play at recess. I don't know who these people were who were running the elementary school, but this stuff changed my perception of the world quickly. I thought I could trust anyone with authority, but after this, I pretty much laugh at anyone that thinks they have some sort of power, authority, or seniority over another human being. This doesn't sound like a bad thing that this person said. This person being the counselor, I mean. I think OP misunderstood the prompt. That aside, though, what a horrifying school situation. So many people involved who should never be in charge of children again. Story 8. When I was 11, I started feeling a lot of anxiety and fear about going to school, church, or basically any place with a lot of people. My brother had been getting therapy for a while, so my parents set me up with a counselor at the same facility. The only session I went to started normally enough. We talked a bit to help me get comfortable. I described what I was experiencing, normal first session stuff. The counselor then asked me to close my eyes and imagine a situation where I felt anxious, and when I did so, instructed me to find Jesus and go to him. Now, I grew up in a religious family, and here, nearly 20 years later, I still believe, but that was not what I was expecting out of an alleged medical professional. Long story short, we did that and nothing else repeatedly for the rest of the hour-long session, aka eternity for an anxious, uncomfortable child. I left with the impression that therapy was BS, and I didn't seek out any mental health care until I was in my 20s. Turns out I've got depression/anxiety issues, and they respond pretty well to medication. If I had had help from a young age, I might have been able to develop coping skills. Instead, I flunked out of college twice and developed an addiction to alcohol. Oh well, live and learn, I guess. Story 9. You make good eye contact and you're an engaging, interesting conversationalist. Clearly, you don't have ADHD. My other patients are drug addicts with no direction in life. You think your problems are as bad as theirs? This guy was an ADHD specialist I was seeing to try and make sense of my crippling executive dysfunction and lifelong problems with attentiveness. He just spent our sessions telling me my problems weren't bad enough, because apparently everyone with an attention disorder is a screw-up delinquent. Also, way to throw your other patients, who are surely coming to you to deal with their own demons, under the bus, dude. Story 10. For this, it's important to know that I live in Germany. I saw a psychologist once who treats and diagnoses adults with Asperger's. I was there for my second diagnostic interview, and my mother was with me to be interviewed as well. She told the doctor about my sensory issues, especially with noise, because I would occasionally scream and punch walls and throw stuff around if I was too overloaded with sound. The psychologist just said something along the lines of, Well, 100 years ago, people like this would have been treated rather differently around here, eh? And laughed in our faces. Even if he wasn't talking about the National Socialist euthanasia, which took place not quite 100 years ago, I still felt incredibly disgusted and angry. The entire interview with him was a disaster, but this was clearly the worst thing he did. Story 11. I was 17, recently homeless because my parents kicked me out for being bi and dating a girl. She was incredibly abusive. She also once unalived a neighbor's dog by feeding it cut up razor shards, and as a result, I was deeply depressed and anxious. I saw the therapist at my college and was told that women aren't abusers, with a real snooty attitude. When I countered with examples, she scoffed and said it must not be that bad if I didn't just leave, and then asked for payment. I was young and scared and had no support net, and in hindsight was trying to find someone to help me mentally steel myself to leave. Instead, the therapist made me feel invalidated and weak and stupid, and as a result I stayed in a relationship that only got worse and more dangerous. I stayed for 5 more years. Eventually figured it out, but she did so much harm. I wish I had that time back. I just will never understand why people like this are even in the mental health field. Do they go home every night and be like, I helped a people today? Because clearly they're not helping much. I feel like no mental health professional should ever approach an issue by being like, well, it can't be that bad, can it? Admittedly, I only took 1 year of psychology in university, but I still think the proper approach would be something more along the lines of, I don't know, acknowledging that that's how that person feels, and if you think it's an overreaction or something, you work on it in a different way. You don't be like, well, it's not that bad. When will that ever help someone with mental health issues? That's so strange. Anyway, moving on. Story 12. Okay, this is actually my mom's story, but it's relevant. 1980s in the UK. My mom is pregnant with me and my dad is, well, not a good person. My dad called my mom when she was out asking her to come home. Mom thought he sounded odd, so asked a friend to come with. Daddy Dearest is drunk, which has brought out all of his angry, violent tendencies, and he fires a gun that God knows where he got it from at my mom. Missed, thankfully. Police are called, a standoff happens, and it's hours before he's finally talked down. The therapist who treats him after tells my mom, who is bracing herself for a good old-fashioned divorce, not to leave him, as he wouldn't cope. Yeah, screw that noise. Unfortunately, they did succeed in guilting Mom into staying, but she got out a few years later and gave me the best childhood. She passed a few years ago, but damn, she was awesome. Story 13. You will never ever be able to have normal social relationships. Other people will always need to adjust to you. In reference to an autism diagnosis on the topic of facial expression recognition. Mine's actually been tested. Turned out I score far above average. Other than that, I also simply never have had any problems with social situations. You will never be able to go to school. You should give up on it. I was 15 and came from a home where I was beat and cursed out daily. They told me I was unfit for school because I had skipped it, and instead made me do jobs like copying books all day for free. This means you're forced to spend the entire day copying leaflets, stapling them, and repeat without anyone to talk to. You will not be paid. If psych patients are paid, it's through disability aid, and I wasn't old enough to apply for that. You're manipulative / a liar. I wasn't. I just happened to have the diagnosis borderline at that time. When they dropped borderline from my diagnosis, I instantly stopped being accused of being a liar. I never lied. You should be nicer to your parents. I came into the clinic with a full report they assembled mostly by talking to my parents. If I had directly said my parents are hitting me and cursing me out daily a bunch of times, they might have listened, but I was a kid, and I wasn't 100% sure I didn't actually just deserve it, so I was cautious and started with things like, my parents aren't always nice, which would then invite the fury of the heavens, because thou shalt not speak bad about thine parents. You should get out of bed. In 3 different clinics, on at least 6 different occasions, a male therapist entered my bedroom while I was in bed, underwear, and told me to get out of it, despite not being dressed with them in the room. This happened from 18 to 20. They would never leave instantly after a no. They would stay and try to convince you. One time, after I kept refusing, this nurse went to the head therapist and I had to have several appointments on not cooperating in therapy. You should compliment yourself. One of my therapies was a compliment book to increase my self-esteem. I was forced to write down things like, I'm proud of myself for having copied leaflets today. They weren't trying to increase my self-esteem. They were trying to force me to accept things like, you're not allowed to go outside. I was in different clinics from 15 to 21, initially under force, later because I had nowhere else to go. This is only a very small selection of some things that were said to me. Remembering it all is kind of intense and I don't want to do more. I didn't end up well. Sometimes I look up other kids and they aren't doing well either for the most part. I know a handful that ended up okay. A few unalived themselves and the rest are stuck in this limbo kind of life, usually addicted to something. I have had about 8 different diagnoses. It started at depression disorder, escalated to various personality disorders, escalated to autism, and now it turns out it was probably all PTSD. Maybe psychiatric diagnoses and treatments have a place, but before we attempt to diagnose someone's mind as ill, we should provide a stable place for people where they can live and go to school/work and see how long their illness lasts. The state of affairs as I've seen them is a goddamn insult to our human dignity, and I will be picking up my pieces and fixing it. Story 14. I told my one and only therapist that I felt like I didn't have a personality, and that it seemed like I changed myself depending on who I was around. He asked me what remains constant. I tell him it's my passion for things, especially fiction, but also just subjects I find interesting, that I'm good at looking up everything about it and retaining 90% of what I read. He laughed at me and told me that didn't make me special, that was just helpful for trivia night. On a more serious note, when one of my friends went to a therapist and told her they didn't feel worthy of being alive, the therapist said, "If you don't want to be alive, just unalive yourself then. There's no point in staying alive if you don't want to be." Baffles me beyond belief, even if this particular therapist was still in training. Maybe it's just me, but I don't feel like the approach to therapy should be the Nike slogan. If a patient is telling you that they don't feel like life is worth living anymore, just do it. Not a great response. Story 15. So I had my first episode with psychosis when I was about 13, but I recovered and didn't need care or medicine. The second time it happened, I was 16, and it was much worse. I saw a psychiatrist at my local health department. My parents had no money, so this was all we could afford. This doctor specialized in mental health for teenagers. He even had an article in the local paper once a week. I had always been overweight and I always aspired to be an actor. Well, in less than an hour, he completely took all of my confidence and dreams away. I looked up to and trusted my elders, so I thought this man knew what he was talking about. Not to mention, I was extremely vulnerable. He said, "You know, most actors and actresses are slim and attractive." Then he said, "Are you ordinary or extraordinary?" He even drew it on a piece of paper and circled extra. "Most people are just ordinary, not special. It's okay to just be one of those people." I never really got over that. I was 16 then and I'm 43 now. I figured if I can't handle my senior year of high school and I had a nervous breakdown, how could I ever handle Hollywood or New York? A doctor's responsibility is to help their patients heal, but this guy just cut a wound in me so deep it still hasn't healed. I'm sure he said more screwed up stuff to me in that session, but I don't remember because of those two things. It feels like so many of these therapists are just presenting what they see as like the truth, and they're like, if I just tell the patient the truth, they will be cured. Remember, kids, depression is a choice. Story 16. I know that this would be a bad scenario for a lot of people and considered the worst. But I've had 3 counselors in the last 6 years or so, and the best one was the most unprofessional ever. But it worked. My previous 2 were these hyper-clinical, safe space understanding and hushed-voiced stereotypes. It just made me very aware that I was seeking help. My third had this loud-mouthed Cockney pub landlady who had seen it all, and that just completely disarmed you. She laughed at dumb emotional stuff I said, called me out when I lied/was talking crap, occasional bit of swearing, and she suggested what some might consider unconventional stuff. It just gave the impression that she cared instead of other health professionals that might nod the hour out. Sure, you might say she gauged what environment would help me best and created it, but there was too much of her in it for me to believe that. Story 17. After a couple long years of medical struggle, my therapist hit a wall and yelled at me that I have an eating disorder and I need to accept it. She put me on a diet of the things I hated eating and told me to come back to her in a month. I hated eating those foods because it hurt. Acidic foods, high protein, peanuts. 4 months after, I'm diagnosed with multiple digestive conditions, have a long list of sensitivities and allergies, declared disabled, and gently reprimanded by my doctors for following my therapist's demand, because it caused esophageal bleeding and slight scarring. My doctors were more mad at her, though, for ignoring what was clearly not a mental health thing. I got a new therapist. And on that lovely note of another type of doctor having to clean up the therapist's mess, we're done for today. This one was a lot and a little frustrating, at least for me, so if you need to, treat yourself to something nice. Have a wonderful day or night wherever you are. Thank you so much for watching, and I'll see you in the next one.